Welcome this afternoon for our guest speaker for Second Saturday. Second Saturday is every month. The second Saturday of the month is free admission to the museum and the original Governor's Mansion, and that's sponsored by the Helena Community Credit Union. I'm Sue Neer. I work at the Montana Historical Society here, and I'm so delighted to have Dr. Stephen Helgerson with us today. Dr. Helgerson was born in Washington. He received degrees from the University of Puget Sound and the University of Washington. His medical specialty is preventive medicine. During a 40-year career in public health, he worked with the Centers for Disease Control and Prevention, the Centers for Medicare and Medicaid Services, and the Indian Health Service, as well as several state and local health departments. From 2006 to 2015, he served as the Montana State Medical Officer, and he now lives in Seattle. Today, Dr. Helgerson will discuss his new historic novel, A Country Doctor and the Epidemics, Montana, 1917 to 18. A Country Doctor tells a story of the 1918 Spanish flu's effect on a small eastern Montana town. His book is available in the museum store, and he'll be signing books after the program today in the lobby. And I do want to point out to you, we have some bookmarks, but a brand new thing that the Historical Society has for you and your resources is a website on World War I historic resources, and it has a lot about Homefront. So I have a few here and up in the front, and check that out when you have time. And today we're going to enjoy what Dr. Helgerson has to say. Thank you.
Okay, thank you. Am I audible? Yes. Okay, thank you all for coming. It's great to see so many friends and some folks I haven't met yet, but I'm looking forward to meeting. Last weekend, Sunday, April 2, was the centennial of the day that President Woodrow Wilson asked the U.S. Congress to declare war against Germany and Austria-Hungary for the purpose of making the world safe for democracy. That's a quote from his request to Congress on Thursday this week, and it was partly celebrated here at the Historical Society on Thursday this week. April 6 was the centennial of the U.S. Congress declaring war and entering the First World War. Today, I would like to introduce you all to some of the information in a book called A Country Doctor and the Epidemics, Montana, 1917-1918, and emphasize that this is a historical fiction novel in which I've tried to be as consistent as I could in fiction, as consistent as possible with the events of the time. So the historical fiction novel is the subject for our discussion today, and the basic story. In early 1917, a physician, fictional physician, Dr. Harvey, comes to an eastern Montana town to provide medical care for patients of another physician who has joined the Army Medical Corps when the U.S. entered the First World War in April 1917. There's a story. In mid-October 1918, the largest epidemic of the 20th century strikes this town, killing dozens of people within a few weeks. Was the town prepared for this epidemic? Was it the only epidemic affecting the town? The only disease outbreaks and epidemic affecting eastern Montana and this town during that time period? How did the physician deal with epidemic disease, and what effect did epidemic diseases have on the physician? Well, the story and the main characters in this book are fictional. The setting and the main events are consistent with the experience of, or at least I've tried to make the story as consistent as possible with experience of people living during that time period. Today, I would like to tell a little about how I became interested to write a book about these events in this place during that time period, and a little about why I opted to write historical fiction, in contrast maybe to a historical journal article or a history book. And I will try to cover those topics, leaving enough time for some questions, because there are so many avenues that one could go down in this time period that I want to see what kind of questions come up, and we'll go down paths that you all may be interested in. So first, well, how did I become interested in a pandemic of influenza, eastern Montana, 1917, 1918? Well, 8 years ago, also in October 2009, I was serving as the state medical officer here with Montana, working at the Cogswell building around the corner with several folks who I see in the audience today. And we received a report of a case of influenza in Mexico, in Veracruz, Mexico. Using the scientific methods that were available at the time, it was soon reported to us and to people around the world that the influenza strain causing illness in this Mexican case was an H1n1 strain. Some of you may remember the H1n1 swine flu episode of 2009. And it also became evident that there had been an outbreak going for several weeks in Mexico before before it became generally recognized. Within a short time of learning of that case, we heard of the first two cases identified in the United States and Southern California, and the interest kind of exploded in news media and television, as well as public health circles, when the H1n1 virus was designated as a pandemic strain because of its relationship with the virus that almost certainly caused the Spanish Influenza outbreak of 1918. So I found myself thinking during April and May of 2009, as we were increasingly and intensely involved in what were called emergency preparedness activities, tracking the occurrence of influenza not only in Montana and the United States, but around the world at that time. And some of you may recall, by October of 2009, President Obama had declared a national emergency. World Health authorities had declared a global emergency related to this pandemic strain of influenza H1n1. Without going into too much more detail about that virus, the emergency preparedness activities in which we were involved stimulated me to wonder what kind of preparation physicians, public health authorities, and others in Montana might have been involved with back in 1918, in the months leading up to especially October, November, the height of the Spanish influenza outbreak of that time period. In addition, around that time, I had a special opportunity to visit a homestead area south of Forsyth, Montana, in Rosebud County, a homestead where my wife's maternal grandparents had homesteaded beginning around 1915. Linda is here. Will recall some of the stories she heard from relatives about the homestead. But when we visited that homestead, I began also wondering about how homesteaders and ranchers living outside of towns or for that matter, how the townspeople living in small towns in Montana were acting or thinking leading up to one of the largest epidemics in history that was coming in October. And so as I had a chance to think about that, and we were continuing through our emergency preparedness activity here in 2009, there were opportunities to visit a number of places around the state, including the Rosebud County Pioneer Museum, sort of their local version of a historical society, the Rosebud County Library. In the basement of the library, they just turned me loose in the basement of the library, and they have a hard copy of all the newspapers. There were competing newspapers in Forsyth in 1917-18, and all those hard copies, and so I spent hours reading through newspapers just to see what was going on at the time. Also the Rosebud County Courthouse. The gal at the desk said, well, yeah, I told her what I was looking for. She said, oh, well, down here. So down in the basement of the courthouse, and I have access to county commissioner records and a number of other records from the time period just to see what county commissioners and newspapers and others were thinking about in the months leading up to the influenza outbreak of 1918. Now also, this wonderful institution, the Montana Historical Society, has materials that are marvelous materials from the time to help think about and try to understand a little about what people were thinking and what people were doing back in 1917, 1918. And what I found, and what became compellingly obvious, is that there were many major events occurring in 1917, 1918, and plenty for people to be thinking about. I've mentioned the U.S. entry into the First World War, the reestablishment of a selective service system, and the institution of a draft. So young men, so there was an urge initially for volunteers, but then the draft kicked in. And you can imagine there was lots of interest in war, draft, selective service. The First World War in Europe had been going since 1914. And the price of wheat and the demand for grain, especially wheat products around the United States, had been steadily increasing since 1914 because of the need for food in Europe. But once it became clear that there would be an army to support in the United States as well as the increasingly devastated populations in Europe, the need for wheat exploded. Ranchers and farmers were transitioning from cattle and horses to plowing up land to grow mostly wheat, but to grow grain, and the prices for the wheat were going up and up. Accompanying that was an increase in the price of wheat seed. Many of the farmers and ranchers who were transitioning to planting wheat were having trouble finding enough money to buy the wheat seed to grow the wheat. So the county commissioner records during the time period all through 1918, including the time of the pandemic once it struck in Forsyth and Rosebud County and other areas, the county commissioners were much more concerned about how to support farmers and ranchers to buy wheat seed to grow wheat than they were about the influenza cases that they were beginning to hear a little about and eventually exploded in their communities. And there were tensions in the community as well. The patriotism that accompanied the entry into the First World War and had Montana communities easily meeting the draft quotas that were established for that time period was balanced in a certain way. Really, a tension developed between that patriotism, almost hyper-patriotism in some cases, and some anti-war or less than enthusiastic war feelings by some parts of the community. German-American ranchers and farmers, for example, were not entirely excited about being at war with Germany. The Finn farmers weren't excited about being at war at all. The Scandinavians generally were kind of had a neutrality sort of feeling. The Irish in some parts of the state didn't like the idea of being allied to England. And there were radical labor groups around. In total, the tension between the patriotism of getting into and supporting the war and the friction with some of the anti-war and less than enthusiastic feelings about being at war led to an extraordinary set of activities that began with charges of espionage, ended with charges of sedition after Montana legislature established a Sedition Law, which became a model for a national law. But these tensions related to the support of the war and less than enthusiastic feelings about the war, exploding wheat prices, trying to help farmers and ranchers buy wheat seed, continuing to meet the draft quotas, all of that was happening as 1918 went along. And then in Forsyth, which is the town, Forsyth and Rosebud County are the site of this fictional story. In June of 1917, part of downtown burned. And for several months, the activity in town was rebuilding some of the buildings that burned. And about a year later, May and June of 1918, the Yellowstone River overflowed its banks, contaminating the water supply in the town, among other things, leading to concerns about typhoid and a variety of other events. So as I took a step back to think about what was going on, I was thinking, well, if it turns out, as I dig further into the preparedness activities for a pandemic of influenza in October, if it turns out that it wasn't the highest thing on people's mind, even if the surveillance activities then had been as thorough as they could be in 2009, then I might not be surprised. But in addition, 1917, 1918, and the years, first part of the 20th century leading up to the entry into the First World War, there was, I'll call it endemic disease. The occurrence of disease month by month, quarter by quarter, season by season, that if we had occurrences of disease in 2017, like the usual outbreaks of whooping cough, diphtheria, scarlet fever, smallpox. There was a run of smallpox cases late 17, early 1918. Big measles outbreak in the middle, statewide, middle of 1918. That was normal disease activity for people living then. And this is before most of the vaccines that we associate with whooping cough or diphtheria or some of the other diseases that were occurring. So when I went about thinking of writing historical fiction, I thought a little about writing a history book because there is a rich source of material with all these events going on, but there are also some very nice books and articles already for people to read. So I wanted to try thinking about the events of the time from the perspective of a practicing physician, a country doctor, and how that doctor might be able to, through interaction with patients and just talking with other folks in town, might be able to reflect on some of these events that I've mentioned, but also would be an opportunity to tell a little about when patients came with certain signs and symptoms to the office, what sort of diagnostic considerations were applied in 1917, 1918? What sort of treatment options were available? Now, in a really nice world, if I could create one, there would be the medical records from doctor offices of that time period that I could go to in, historical society or hospital basement somewhere and look through it. But mostly, those medical records of that type don't exist, and if they do, they're protected by a variety of confidentiality and privacy laws. So that's when I really decided that historical fiction was the only way I would be able to go about trying to tell the story I was thinking about. I was able to learn a lot from history of medicine materials and from what was known about what kind of diseases and how were diseases diagnosed and treated at the time. There are records, general records about that, even if I can't find the specific records for a small eastern Montana town. And that is where historical fiction approach to this time period began, with the idea of telling a story from the perspective of a fictional physician, with the doctor being able to, through dialogue, readers learn a little about what is happening in the community and some perspectives through dialogue, but also what the doctor is thinking sometimes after hearing a comment at a restaurant or talking with a banker or whatever. And so what the doctor learns and what the book attempts to tell about, and what readers may find interesting, is from the doctor's perspective in working with homesteader families, a little about life on homesteads, a little about how diseases would be recognized and treated or not, especially injuries in ranch and homestead settings that were far from towns. What the doctor learned from a public health nurse, one of the characters in the book. Now, as an aside, some of the folks here may know that the public health nurse activity in Montana was just getting underway around 1915. The state health department, what was then the 1917 version of the state health department or board of health, had managed to get the state legislature in the 1915 session to appropriate a little bit of money to have public health nurses around the state. And by 1920, there were 35 public health nurses around the state. Not quite that many in 1917-18, but in this story, there's a public health nurse who is working in a couple of counties around where the doctor is, and that gives the doctor a chance, and readers of the book a chance to learn a little of what the public health nurse is learning, largely related to maternal and child health care, which was largely the impetus for funding the programs. So pregnant moms, pregnant women, and women caring for young children, mostly in rural areas outside of towns around Montana. Or the physician talks with the county commissioner, a fictional county commissioner, but the events and the discussions pretty consistent, I think, with what was going on then. County school superintendent, a little about schools and how diseases are recognized or not in schools at the time. The doctor, by having a German-American family in the patient population, learns a little about the experience of a German-American family during a time when sedition charges were being more than entertained. There were charges, there were trials, convictions, and you probably know about 4 dozen people imprisoned, time periods ranging from 1 to 20 years during this time period. And the doctor has patients. So patients come with one or another kind of disease problem, allowing a writer of historical fiction to say a little about what the doctor and the patient might have talked about and what some of the treatment decisions might have been for venereal diseases like gonorrhea. This is pre-antibiotics by decades and pre most of the vaccines that we think about, or a young man with diabetes, a young child, the mom of a young child with diabetes, pre-insulin. No insulin until the middle of the 20s. Or persons with congestive heart failure, then called dropsy, people with TB, then called consumption. And so readers of the book will have a chance, I hope, to think just a little about what a practicing physician at that time period during the U.S. participation in World War I would be seeing, and how treatment decisions were being made for patients in general. And for some of those patients, the stories that relate to activities in the town become the basis for A Country Doctor and the Epidemics. Now, I don't want to try to be over dramatic about this, but there's a mystery in the book too that could be recognized. I've quizzed just a couple of the early readers of the book, and early in the book is a question about what's happening to this doctor. And by the end of the book, find out. So the Country Doctor and the Epidemics, plural, is the basis for the story. But because in real life so many things were happening, there were so many things to write about and to think about. And I think rather than, I could say a lot about medical practice at the time, how medical schools were being modified, trying to catch up with some of the scientific advances that began in the middle of the 19th century with Pasteur and Koch and the whole bacteriology age. Medical training was changing. Medical treatment, we could talk about that. We could talk about how the Army, in 1914, when the First World War started, in Europe, became evident to a number of leaders in the United States that the Army, including the Army Medical Services, were not really ready to be involved in a world war. There were 140,000 physicians about licensed in the United States in 1914. 770 were in the Army. A new Surgeon General was appointed, Gorgas, the same Gorgas famed for his work in the control of yellow fever in Panama earlier in the century. Gorgas started adding things up and said, this isn't going to do. If we get involved in that war over in Europe, 700 physicians and the kind of services we're providing aren't going to meet the demand. So I could talk a little about really interesting things that happened in trying to put a medical corps together in the Army, and what the Army was using for treatment, and how that Gorgas was trying to be as scientific as possible, which was not always what physicians in the general community were doing. The whole level of how competent the medical services were in the country, and how to try to get competent medical services into the Army. That's a story. Nursing care. One of the bottom line messages for the Spanish Influenza outbreak and trying to deal with it in 1917, 1918 is medicine didn't have a whole lot to offer. Nursing care was what was done that helped patients was nursing care. And we could talk a little about that too. Hydration, nutrition, using cold towels to bring fevers down. But at the beginning of the World War I in the United States, there was one nurse for every 4 physicians. And once the U.S. entered World War I, many of the nurses in the country were drawn one way or another to be nurses in the Army nursing corps. So fewer and fewer. Already there weren't too many, and then there were fewer and fewer nurses left in general community. So the best you could do for influenza was hard to provide in many cases. And then there were communities, some communities did have hospitals, some didn't. There's much we could talk about. I could say more about the influenza pandemic and some of the statistics that go along with that. But I think at this point, rather than me picking paths, I wonder if there are questions, and I might, in responding to some questions, we might be able to get into some additional information.
How does the swine flu epidemic in the 1970s compare to the H1n1? Was that the same thing?
I'm going to repeat I'm going to try to.
Vaccinated everybody and gave
Yeah.
them a break?
Yeah, I'm going to try to repeat. I'll summarize your question, but this is being recorded, and just to be sure that the question gets into the recording, the essence of the question is, how does the occurrence of epidemic or pandemic influenza, whether it's 1918 or 2009 that I've mentioned, how does that relate to events in 1976 when an H1n1, part of the answer to your question is that it was an H1n1 version of the influenza virus that was identified among soldiers at Fort Dix, New Jersey at the time in 1976. And similar conclusions were drawn in 1976 that it was likely related to the kind of virus that caused the Spanish influenza outbreak of 1918. So there were concerns about whether the country, United States or elsewhere, was ready to deal with the pandemic. And the version of that virus, H1n1, that was identified at the time, was a new identification, just as in 2009, so vaccine was not readily available. In 1976, it took months from the time, and happily, the story in 76 was not happy for several military staff at Fort Dix, but for the country, there wasn't much spread of influenza at that time in 1976. But there was the stimulus to prepare a vaccine. And because of the techniques that were the only techniques available for making vaccine at the time, it took months and months to prepare the vaccine. And then once the vaccine was prepared, there hadn't been too many more influenza cases leaving the administration, Gerald Ford being the president at the time, and some of the leaders at CDC actually lost jobs during this time period. Dave Sensor was director of CDC. But once the vaccine was prepared, there hadn't been very many influenza cases in 76. And so when the vaccine was ready, when the cases were first announced, everybody wanted vaccine, no vaccine. Got the vaccine ready. By the time the vaccine was ready, then among the first cases, among the first people vaccinated, there were some side effects. And when the side effect story then made it difficult to get people to come to be vaccinated once the vaccine was ready. And you probably recall, you and I may be the only two people in the room who recall Gerald Ford getting vaccinated on the president getting vaccinated on TV. And part of the reason for that was to try to increase a level of confidence about the use of the vaccine. So I could say more about the 76 outbreak, but virus strain H1n1 influenza was called swine flu because part of the genome of you may know that every known version of influenza virus infects birds. So when I hear somebody talking about bird flu, I say, wait a minute, all flu is bird flu, so okay. But some versions of influenza virus infect swine, pigs, as well. And the H1n1 the version of H1n1 that we now know was the cause of the 1918 pandemic and was identified in 76, and then again identified, but in a slightly different version in 2009. The 2009 version was called the triple reassorted version of H1n1 influenza because part of the genome was the virus associated with human infections, part with swine, pig infections, and part with bird infections. And so we were so sophisticated by 2009 we could scare people not only with H1n1, but we could talk about triple reassorted version of the virus. And in 2009 there wasn't a vaccine readily available either, but it took only a few months because of improved techniques. And by the time President Obama declared the national emergency in 2009, the vaccinations began in November, late October, early November of that year because of some different techniques that were possible for making vaccine. So 76 was a good one too.
Two things. One was, early in the book you talked about
Judge Crum.
and then Wheeler.
Yeah, Burton Wheeler.
I wonder if you could talk a little bit more about that. And then the other question that I have is, from your research, and maybe you don't want to name names, but in Forsyth, were people convicted or arrested and convicted of sedition?
I'll say just a little about this. I won't name too many names, and one of my there's a little bit of a balancing act in the book for people who are really knowledgeable. Actually, I can't wait to do, if invited, to do a reading or a discussion of the book out at Forsyth. I'm sure there are family members, there are relatives of some of the fictional characters in this book. But it turns out that Forsyth, I'm going to say a few words about espionage and sedition here for a minute. It turns out that Forsyth, if one were looking for one town in Montana to tell the early part of the sedition, espionage sedition story, Forsyth would have to be near the top of that list. A legal case, near the end of 1917, began when a rancher named Vess Hall, who ranched in southern Rosebud County near the town of Ashland. He was a German American. And when he learned that the U.S. had declared war on Germany, he said to some of his friends, I won't say exactly what he said, but he did not think it was a good idea for the U.S. to be at war. And in his opinion, other forces, there were secondary gains having to do with economic gain for what we would call large corporations, but he was very critical of the war. And the people he was talking with felt differently. They felt it was very important to support the U.S. war effort. They reported to the county attorney. I don't mention the county attorney in the book. County attorney was Haynes. And a charge against Vess Hall was made late in 1917 of espionage. because that was the law that was available to make such a charge at the time. The county sheriff got Hall and brought him up to Forsyth. Haynes, the county attorney, really wasn't in a position to arrange a trial right away, and they didn't want to keep Vess Hall in the jail for a period of time. So Haynes arranged for Vess Hall to stay at the Alexander Hotel, which is pictured on the front of this book. Now, the book doesn't go into the story I'm about to tell. It doesn't go into it too far, but it does a little ways. Vess Hall and a local banker, I'm blanking on his last name right now, but the two of them were put up, because they were both charged with espionage, they were put up at the Alexander Hotel. But Vess Hall went out for a walk that night, and he saw Judge Crum. Judge Crum, Charles Crum, was the district judge, the Montana district judge for that area. And he was aware of what was going on, and when he talked with Vess Hall, he advised, because apparently there had been some talk about a lynching. And Judge Crum, one of the folks you mentioned, lived in Forsyth, talked to Vess Hall, advised Hall to go over to Butte, where there was a judge named Borkwin. And so Vess Hall and the banker got on the train and went off to Butte. And as soon as Haynes and the sheriff, the county sheriff in Rosebud County, heard about this, they called ahead and had the Silver Bow County police pick up Hall and the other guy, put him in jail in Butte. Borkwin, who is a judge, really notable for some of his decisions, arranged for a trial to be held up in Helena. There were activities in Butte at the time having to do with anti-war sentiments that made Butte a less than optimal place to be trying to pick a jury for a sedition trial. So the trial was moved up to what was arranged for Helena. Borkwin presided at Vess Hall's trial. Judge Crum spoke at the trial. He was a witness at the trial, and he took the position that that what Vess Hall had done didn't really qualify as espionage. It was hard to imagine how a rancher in the southernmost part of Rosebud County was effecting the U.S. war effort in Europe. But that was a charge. And Haynes, the attorney from Rosebud, was the prosecutor for the Helena trial. And Borkwin found pretty much what Crum testified, and that is that the words that Vess Hall spoke were probably ill-advised for the place. They didn't break the law. And that trial ended, I think, around November. Before 1917 was over, that trial ended with acquittal for Vess Hall. But the patriotic fervor really was really sparked at that time, to the point that political forces in the state really forced and encouraged the Governor Stewart, at the time, to call a special session of the legislature, which he did. So in 1918, February, March of 1918, notable time, Montana history, and the purposes for this special session of the legislature included getting some binding authority for counties to use in order to help farmers and ranchers buy wheat seed. And the whole issue of whether Montana should have its own sedition law so that it didn't require espionage to convict somebody of speaking against the war, but sedition, so a different level of charge could be applied. The special session of the legislature was held. The Montana legislature passed the Sedition Law, and by June and July of that year, there was a national law modeled on the Montana law. So it's a notable sedition law. But another reason for the special session of the legislature was impeachment of Judge Crum. They sent a longtime senator, I won't say too much more about the senator, also from Forsyth, who was a major leader and very patriotic senator. He felt it very important that the people of Montana let everybody know that what Judge Crum did wasn't right, and let's impeach Crum. And so towards the end of February, the session of the legislature was getting to the step of impeaching Judge Crum. Judge Crum, several days before that, resigned. But the legislature said, no, we're going to impeach him anyway. We send a stronger message with impeachment. Now, why did Judge Crum resign? This is kind of a sad part of the story. But his son had cancer, and his son was in a hospital over at Miles City, and Crum didn't want to come here. So Crum got impeached. We got a new sedition law. We got bonding authority to buy wheat seed, which became the major topic of discussion for the county commissioners in Rosebud and other counties for the next number of months. And then one other thing happened in the special session of the legislature. You won't believe, I still have to read this to be sure it's true. A gun registration law was passed. 1918, special session of the legislature, February 1918, making county sheriffs responsible to register all the guns in their counties. The driving force was kind of a fear-fueled idea that somehow German Americans and others who were against the war there was going to be an uprising in Montana. We needed to know how many guns and where the guns were. And so when I read through documents from this time period, down in I spent a little time in the Gallatin County Historical Museum as well, and the sheriff was complaining. I kind of understand he was complaining about how much time he was spending trying to get the guns registered in the middle of 1918. In Gallatin, same thing over in Rosebud. So Judge Crum and Vess Hall, both from Rosebud County, were part of an activity that started with an espionage charge, ended up with a sedition law and gun registration. And while this was all happening, to get back to public health for just a minute, because I thought of this when I mentioned Gallatin, there were smallpox cases occurring, late 17th, little clusters. Cogswell was trying to get the Board of Health to do a little more about encouraging vaccination. And so at a certain point along the way, there were discussions about having a school entry requirement. If you want to go to school or you want to work in a school, you need to be inoculated against smallpox. That was new thinking at the time. But down in Gallatin County, the county commissioners, even before the state weighed in on this, the county commissioners, knowing that these discussions were occurring, took the step of establishing school entry requirements in the middle of 1918. If you wanted to get into a Gallatin County school, the kids and the workers had to have proof of smallpox inoculation. A group over in Butte called the Freedom League, very patriotic in their view, came to the Gallatin County. They may be a couple of counties away, but they're coming to the Gallatin County Commissioner meetings to argue against this idea of government intruding in people's lives to the point of having a smallpox vaccination school entry requirement. And the Freedom League arranged for an alternate slate. There was an election coming up at the end of 8. And so there was an alternate slate of candidates for Gallatin County commissioners, sponsored by the Freedom League from Butte. And the commissioners, the incumbent commissioners in Gallatin, all won, but they barely won. And the big issue for that election, you know, we're coming up on biggest outbreak, the biggest pandemic of influenza in history, in this country anyway. And what else is happening in the country? Sedition, espionage. We're gonna replace the commissioners in Gallatin County because they want to have smallpox inoculation in order to go to school. So if one is, if I take a step back and I think, why weren't they having emergency preparedness activities of the kind we were having in 2009, even if influenza viruses had been identified by that time? Influenza virus wasn't isolated until 1931, 32. The influenza vaccine, first version of it, not available until 1938, just before the Second World War. First FDA-approved influenza vaccine post-Second World War. So back to 1918. We're not, it isn't even entirely clear that a virus is the cause of influenza. The investigators of the time, bacteria were known. And it was pretty clear in laboratory studies that were being done at that time that the cause of influenza was something that they were referring to as a non-filterable particle. The laboratory techniques were such. I'm just looking to see if we have any lab people here, but the laboratory techniques of the time could filter what we think of as many of the bacteria. So they were filterable, but something non-filterable was probably causing influenza. But it was another decade before virus was actually identified. Among the filtered things was, especially in Philadelphia, there were some researchers in Philadelphia and several other places around the country who kept isolating a bacteria from some of the early cases, human cases with influenza. And the bacteria that they were isolating had been identified back in the late 19th century by a German investigator named Pfeiffer. It was called Pfeiffer's bacillus. So during the period 1918, 1919, when the influenza pandemic was occurring, some investigators got the idea that Pfeiffer's bacillus, and they renamed it. They were getting it from patients, some of whom were coughing blood and had severe lung disease. And so the name Bacillus influenzae was applied in place of Pfeiffer's bacillus. Now, in the course of events, turns out that is not the cause. Nomenclature changes later in the 20th century changed Bacillus influenzae into Haemophilus influenzae. Some of you know that does cause disease in meningitis in kids. Now we have a vaccine. Since the 1990s, we have a vaccine for that. But that bacteria was being isolated from some of the cases with influenza. And so investigators like a Dr. Lewis in Philadelphia and Rosenau and others in Minneapolis, Rochester, where the Mayo Clinic is now, thinking that might be the cause of influenza, developed some vaccines. And the vaccine if you read somewhere about vaccine being delivered, including in Montana, to people with the goal of preventing influenza, there was a vaccine, and it was used in some cases, about 400 doses apparently in Havre at a certain point, a couple hundred in Billings at least. Those places, because doctors in those places had connections. They were docs who had trained in back at what we now call Mayo Clinic in Rochester. And so they learned a little of the vaccine development, had doses brought out here and delivered. But Cogswell, Dr. Cogswell, after whom the Cogswell building is named, he was his title was Secretary Board of Health. He was the director of the health department only from 1911 to 1946. So he was a major figure in Montana public health. And during this time period, the Board of Health was thinking about things like influenza. Once the pandemic really got started in some of the communities, and Cogswell looked into the issue carefully enough he was not convinced that this was an efficacious vaccine. He was advising against it, advised against the use in Havre, advised against use elsewhere, but it was still used. So no, virus hadn't been identified, but a potential etiologic agent identified turned into a vaccine. Some places in Montana, the vaccine was being used. And of course, the whole idea of vaccine, it's almost like the smallpox entry requirement for school. The whole issue of vaccine just inflamed further some parts of some folks in the community who didn't want unnatural things. And you may, I don't know if you've gotten to the part of the book yet where Dr. Harvey is talking with the county commissioner, and they're kind of tossing around ideas about different steps or different approaches that one might take. And one of the common pushbacks against vaccination was it was unnatural. Dr. Harvey says, well, maybe influenza is unnatural too, but you know what happens, and maybe we can.
Are there any adverse side effects from that vaccine?
I don't know for sure. I keep looking at Todd while I'm talking about this because he and Greg and others are looking into some really important issues of the time, and I haven't dug that angle yet, but I suspect there were some side effects, and I'm not sure why. I don't think it was just Cogswell discouraging that ended the vaccination effort, for example, at Havre. So, but I don't know whether Havre Hospital files in the basement or whether there are notes from a doctor office. Here at the Montana Historical Society, I was looking for some physician records, and what is possible to find here that are pretty interesting are registers, some of which are like this tall books, financial registers from physician offices. So you can go day by day, patient by patient. You see names, so much for confidentiality, and see names of the patients, but not learn what the disease problem was or what the treatment was. But Mrs. Jones visited the office today, charged $1.50. I visited Mr. Smith 5 miles south of town, $2. The next patient, 15 miles south of town, $2.50. So you can kind of get an idea, and the offices were pretty busy, even outside of pandemic times during this time period.
Do you have a sense of the population at the Homestead area versus now in that area? Was it larger, same?
Yes, I don't have exact data,
Probably just a sense of it. Yeah.
but the Second Homestead Act was 1907. So pre First World War, the first Homestead Act had been back in the middle of the 19th century, President Lincoln, etc. The second Homestead Act in leading up to 1910 made land available to homesteaders again. And the railroads especially liked the idea because they were cut into the deal in such a way that for every, a mile here for homesteaders and a square mile there for the railroad, was advantageous for the railroads. And partly related to railroad advertising about how nice the countryside was. And it was a relatively, the first part from 1910 or 11 until about 1917 roughly, it was an unusually wet period in eastern Montana. The more drought-like conditions began around the time 18, 19, and in there. So there were these inducements for people to come, and largely distributed by railroads. Throw all your things in the boxcar and somewhere in the Midwest and get off, unload the boxcar in Forsyth or lots of other towns. The Northern Pacific Railroad, the reason Forsyth is a town, really, it was a steamboat landing in the mid-1870s, not too long after what the Crow called the Custer Battle and we call the Little Bighorn battle. Not too long after that, it became evident that better transportation systems were needed. Some steamboats were coming up the Yellowstone River at the time, so Forsyth started as kind of a steamboat station. But in 1881, the Northern Pacific Railroad, not to be confused with Great Northern, the Northern Pacific Railroad came by and was following the southern bank of the Yellowstone River, and Forsyth basically is a switching station. It had a roundhouse and major railroad influence, 1880s. A certain number of ranchers and sort of earlier homesteading activity pretty much filled up the Yellowstone Valley in the 1880s and 1890s. Then around 1907 or so, another railroad called the Milwaukee Road had come, and it made it into Montana, also to Forsyth on the north bank of the Yellowstone River. So the Northern Pacific's on the south bank, Milwaukee Road, and at Forsyth, the Milwaukee Road then takes off across the middle of Montana. Venanda, Ingomar, Roundup, etc. Whereas the Northern Pacific is running to Billings, Bozeman. So both the Milwaukee Road and the Northern Pacific were encouraging people to take advantage of the homesteading, and there was an explosion of a population explosion in town, around towns like Forsyth and Ingomar. I mean, Ingomar is a big town, but it grew more, and many of the activities around Ingomar and some of those other smaller towns exploded during this time period. So you can take right here at the Montana Historical Society, you can get the, what's that guide? The city guide. It's like the phone book from the Times. You can go through and see who's living in town, and it's great. But if you go from 1910 to 14 to 16, living south of town, 10 miles south of town. So many people, and by the mid-20s or so, many of the persons who had homesteaded needed to go elsewhere. Weather got back to normal. And the land where many of these homesteads were are really more intended as large cattle ranches than they are either 320 or 400 acre. Second Homestead Act had a half section, so 320 acres of land is what folks got. And you needed to be lucky and get a well and have a little bit of rain to grow something, or else be working elsewhere to help support the homestead. Despite that, though, the homesteaders survived for quite a while. And talk about challenges in life. Try homesteading. Or better than that, I allude in the book, one or two places I allude to, I tried to be a little bit evocative in some places, like what the doctor might be feeling like driving in the winter out one of these roads. I mean, he's in a car. But it gives a chance to think a little bit about to the south and southwest of Forsyth, our reservations, Northern Cheyenne and Crow. So the doctor thinks a little bit about how was travel, how was life, how was travel on a horse in this kind of weather, on this topography. So there's lots to think about, and I try to allude to a few things in the book.
Question, or two questions, I think. In the book, a couple points you talk about Dr. Harvey trying to establish quarantine and work with the local businesses.
Yeah.
One question is from your research, did they actually shut the bars down?
Yes.
And then there was another one too. I'll think about it in a second.
Yeah, in real life, let me read just in part of response to that question. I may need to put glasses on. Ever since I got to be 100 years old, I'll get to that question. But there was in late September in this book, and in late September in real life, the Board of Health was coming to the conclusion that maybe some attention needed to be paid. So there were a couple of weeks of emergency preparedness. But in the book, Dr. Harvey has seen patients throughout a day. And then later that afternoon, after the last scheduled patient had left, he sat at his desk. He made notes in the records of patients he had seen, and he noticed an unopened envelope that his assistant left on his desk earlier that day. The envelope was addressed to Kelly K. Harvey, MD, County Health Officer, Forsyth, Montana. Came from the State Board of Health. He sliced open the envelope with a folding pocket knife he called his real Barlow. He kept a knife in the drawer of his desk. He removed the letter. It was signed by William F. Cogswell, MD, Secretary of the Board of Health. The letter was to all county health officers in Montana and listed 7 emergency regulations for control of Spanish influenza. Dr. Cogswell anticipated the State Board of Health would enact these at its October meeting. He wanted to be sure county health officers were aware of these rules. And what I'm about to read is available in its original on the second floor of this building. The emergency regulations, late September. We're about 2 weeks away from dozens of people dying in Forsyth. First, Spanish influenza is hereby declared to be infectious, contagious, incommunicable, and dangerous to public health. Second, all patients suffering from influenza must be reported to the local or county health officer as soon as the diagnosis is made. It's the first time influenza is reportable in Montana. Local and county health officers shall make a written report to the state health department Saturday night of each week of cases reported to them during the week. They shall report by wire any unusual outbreak of illness. When Spanish influenza, the third, when Spanish influenza appears in epidemic form in any community, the health officer having jurisdiction shall close the schools and prohibit all public gatherings. So I'll come back to that. Fourth, patients suffering from Spanish influenza shall be isolated as completely as possible until recovery. They shall be prohibited from any public gathering and from traveling on any common carrier. Trains. Fifth, when treated in hospital wards, patients suffering from Spanish influenza should be screened, literally screened, from other patients. Sixth, all discharges from nose and mouth of patients should be disinfected at once. And seventh, on recovery or death, room or rooms in which the patient lived while sick must be thoroughly cleaned. Clothing and bedding used by the patient must be hung in the open air for at least 2 hours. There you go. So those are the 7 regulations provided late September, really not enacted until the second week of October. And as you know, there some cases of influenza had begun being recognized along the High Line, Scobie, Glasgow, Hinsdale, Wolf Point, mid to late September, but the real blast of cases was in the middle of October through roughly through the end of the year. So these emergency regulations came sort of in time, and they were mostly not, except for designated health officers and a few others, there's nothing in the newspapers, the weekly newspapers of the time. At a certain point in the newspapers, we just start reading of the deaths and the need for a hospital if you don't have a hospital, and how do you... So the quarantine. When in Forsyth, as in several other cities in Montana, the idea of prohibiting public gatherings led to a variety of discussions. There were ministers complaining because church services were being restricted, but there was not similar restriction at the bars and the saloons in town. So the closing of public gatherings wasn't entirely predictable, but mostly, as close as I can tell, saloons and bars were restricted from serving alcoholic beverages. And there was a little, it's almost like another epidemic, but there was a little epidemic of alternate sales practice at bars, Butte, Forsyth, and elsewhere around the state, what we might call packaged liquor sales. So the bars were selling, the person who wanted something to drink would go in and they'd be able to buy the beverage, but in an unopened bottle, in a package, and then take the package away to drink. So packaged liquor sales became part of the response to the prohibition of public gatherings that included bars. Now the mayor over at Butte was famed at the time for standing up for bars. He didn't think it was a good idea to be closing the bar. In Butte, and his logic was that a good stiff whiskey is better than any of the medicine available anyway, and so you should keep the bars open. Now, I'll think of one or two other things related to this quarantine business too, but it worked. There were quarantine measures, and they worked up to a point. One other issue was at play at the time. In November of 1916, by a referendum, voters in Montana passed the state prohibition of alcohol sales and distribution to go into effect at the end of 1918 and beginning of 1919. So here we are in October of 1918. The bar owners and others know that prohibition is coming. They don't like the idea of losing their last few months of business before prohibition is going to shut down most of the bars in the state anyway. But it did give an opportunity to practice a little bit on packaged liquor sales. On the medical side, I don't go into this in the book, but on the medical side, there's the question of what really is restricted with prohibition of the sale and distribution of alcohol. Many of the medications at the time, cough syrups and other things, were more alcohol than anything else, leading to questions. That's a whole other discussion, but the question about was it still legal to be selling some of the cough syrups that were being sold or prescribing some of the medicine that was being delivered once prohibition went into effect. And in Montana, early 1919 went into effect, so it was a couple of years before the national prohibition. Yes.
This was the time when everybody was getting drafted, all these young men and recruits being disease vectors all over. But isn't there a reasonable argument that the Spanish lady actually started at Fort Riley?
Yeah, I don't know how much time we have, but this is an interesting story, and it has to do with where did the pandemic influenza start? Why do we call it the Spanish influenza? Before I get to the Fort Riley angle, it's called Spanish influenza largely because of the time it happened, not so much the place. In the spring of 1918, there were cases of influenza that were a little milder than the ones famed for October, November. And it's clear that influenza was affecting European population, troops and general population in Europe into the summer of 1918. And there was kind of an explosion as if the virus might have evolved, and that's where the Fort Riley comes in. I'll get to that. But the number of cases of influenza occurring in France and Belgium and the front of the First World War was striking. There was plenty of influenza occurring in certainly by August, September, but in June, July, August on the Western Front. The news blackouts related to the war for both for France, but for the Allied settings and for the Central Powers, Germany, Hungary. News blackouts didn't allow much detailed news to get out of there. Spain was kind of sitting on the side. They were having plenty of influenza too, but newspapers and reports out of Spain were getting out. So the first reports that got to the United States and to some other parts of the world were reports of this widespread outbreak of illness continuing to spread around Spain. Same thing was happening in France. It's just that the news came out of Spain and got called Spanish influenza at the time. Now, whether the virus that we know as the Spanish influenza that caused the Spanish influenza outbreak really originated in Europe or China, there are competing theories. And I think no one will ever know for sure. But you can make a case, and some investigators have, that in the late spring of 1918, in the United States, in Kansas, outside of close to Fort Riley, there was a fort called Fort Dunstan. And recruits, draftees, were being congregated there. A lot of young men who had been exposed to almost nothing, living in rural areas, congregated. So one theory is that the virus of the spring, the H1n1, now how do we know H1n1? Tissues from deceased persons of the time, studied years later, linked back. There's pretty good evidence that it was influenza H1n1 in 1918, but they didn't know that at the time. They just knew people were sick. The illness occurring in the spring up to about summer was pretty mild, and then all of a sudden got very severe, so that young people, in most influenza years, the very young and the very old and the immunocompromised are the high risk. And they were still high risk for the Spanish influenza outbreak as well. But during the Spanish influenza outbreak, young persons, like young men, young women, like Army recruits and that age group were affected in a striking way. And based on the experience in Kansas and Army medical records from the time, it's at least suggested that somewhere around May or June of 1918, the severity of illness did a real uptick. One can argue that there might have been a mutation of the virus, a shift rather than a drift of the virus might have occurred about that time. And then maybe not fortuitously, troops from Dunstan and Fort Riley were major training centers at the time. In real life, Dr. H1n1, who I mentioned in the book, he had been in practice in Forsyth from 1905 until 1917. One time he was even elected the mayor of the town. So pretty well established, but war comes along, volunteers. And then before he left town, before he was going off to Fort Riley to be in the Army Medical Corps, he went to a lot of effort to get another doctor to take care of his patients. That's kind of where I got the idea for getting, how do I get Dr. Harvey to Forsyth? Well, in real life, there were some efforts to get some physicians to cover services for ones who had gone off to the Army. And so Dr. H1n1 did go off to Fort Riley. A large training center there. And by the middle of the summer of 1918, all those trained troops were now being sent on trains over to Boston and New York and some other harbor areas in the United States. So if you couldn't cram people together enough in the training setting at Dunstan, why not put them on a train, cross-country trip, then put them on a ship to go to Europe and fight in the war. By the time the U.S. troops started arriving, and the ones who, some died in transit, but by the time U.S. troops really started populating the shores of France and that area, there were a lot of sick troops. That's mostly what the Army physicians were up to at the time, was trying to care for influenza and why they needed all those nurses. But the Fort Riley, Fort Dunstan theory or hypothesis would have a mutated virus in Kansas. Are we in Kansas anymore? In early summer of 1918, transported straight to Europe, and then more severe. It seems that the illness that was occurring in Europe got more severe around that time too. Now, whether it really happened that way, not so sure. But the severity of illness definitely took an uptick summer to early autumn of 1918. The United States, returning, part of that theory goes some of the returning troops from ports in Europe back to Boston especially. So Boston was one of the hardest hit and first hit towns. The Spanish flu tending to move more east to west than otherwise in the United States. And so the theory would be that returning troops were part of the reason the updated version of the virus got back here and then spread west. Now, a theory waiting to be worked out is why were the first recognized cases of influenza, the first deaths coded. Todd Harwell here is from the health department is looking into this. So, and if one looks at death records for Montana in September 1918, you begin to find influenza deaths, but it's up on the High Line. Scobie, Glasgow. Why? Any theories about why? Now, I won't say Great Northern Train runs up there, but any theories about why illness like this might sort of distribute along the northern part of the state, and it takes a week or two later before we get to Glendive, Miles City, and across the middle of the state. So that if you get a graduate student sometime looking for a master's paper or a little work to do, I think it would be possible between the Historical Society and the vital statistics. It would be possible to look at that issue